It's the Health Show with Barb. And Barb, we're taking a little different stroll today. We always talk health, which is important, but we also want to look at some of the ramifications when it comes to you being able to get the best treatment or health that you want for your own body or your own peace of mind. And you brought up to my attention that the last federal budget, Bill C47, under Division 20, the Food and Drug Act, there's some natural health stuff going on there that I had no clue about, which could have ramifications down the road for folks that like to use the natural products, and especially in your field. I want to take just a minute or two and sort of dive into this. I hope you don't mind. I know it's not what we do, but I think it's important that maybe we explain a little bit to people so that they can go and maybe they need to talk to their MP, their MPP, both provincially and federally, and say, hey, what's this all about? Because it seems quite hidden. I didn't know about it until you sort of educated me on it. So sorry for the long-winded explanation, Barb, but you have the floor.
Okay, thanks so much, Dave. And I really appreciate your explanation because honestly, it's not my lane. It's something that came across my desk, which is highly, highly concerning to all of us as Canadians because something stinks on Parliament Hill right now, and it's nothing to do with all the wildfires out there. So I think that I'd like to call attention to everybody that does want to take a proactive and preventive role in their health care. That there are always undercurrents, from what I understand, things, bills that are out there, and then you know floor kinds of things that are within them. But I do really, really recommend that you reach out to your governmental people and look into some of the changes that may be affecting us in regard to the types of supplements that we'll have access to even the healthcare professionals that are out there, because some of what I have read about this, it may cripple a lot of the industry and remove a lot of the products from availability, as well as being able to use things at a therapeutic level, and really to just take responsibility as we've been accustomed to, which is our basic rights to be able to make those healthcare decisions for ourselves, educated decisions. And, with products that since 2004 in Canada, we are a very unique market. All of these products to be on the market have to have what's called an NHP, which is a natural health product number, an NPN. So it's not a DIN number, but it's the natural supplement equivalent of a DIN. So these companies they've already put massive amounts of money into having these products proven, that, if there's a claim on the label, they've already proven that through science and put the expense into it, and all of a sudden something's going on that may strip all of that work and all of that money away, which will drive up the cost to the companies if they survive through the tariffs at all, and directly affect the availability of what's out there, and basically our right to make our own decisions about how we want to handle our health. So it's really super concerning.
And these are products that are already in the country, made by Canadian companies as well.
Yep. Yes,
Okay.
yes. I mean, I can understand it for things that are out of country for sure. Because people can easily access, through different channels, things from different countries. But Canadian products have to have that NPN. I've always encouraged people to look for that on the label. So I don't quite understand how and why this can happen in Canada with our Canadian products, and why we are suddenly under such a drastic threat. But I really want, our public to know, and that we need to stand up for this, because that this isn't something we can let slide by without taking a stand on. It's too impactful to the rest of our lives if we don't do something about what this undercurrent is.
I could understand if there was like an underground market of a product that was maybe not approved You know what I mean? I could see that, but I think what you're telling me is that within the organizations that you work with, as far as approvals of product, why are you messing with that? Because it's already meeting the standard that you've set back in 2004, I think you said.
Yeah.
So yeah, I agree with you. I think there's something else here that I don't quite understand. But I think that if you jump through all the hurdles and your product is sound and it performs, then it's been proven. What's the dilemma? It's,
Mhm.
you can go, does this expand into the other medical fields? You got to wonder, right? Um, so yeah, I think so. You've got a website. Do you have a website or something where people can go and find this information? Because when you told me, I went right to Bill C47 and started to look. I found it under Division 20, which is the Food and Drug Act, natural health products, which is another way, folks, to go and if you want to educate yourself on this, then you should for sure. Like Barb
Right.
said, be aware of what's going on.
Yeah.
The last thing we need is higher prices and more tariffs on things that are already in this country that we can use to help our health, which is
Mhm.
critical to all Canadians.
Well, it truly is. And I mean, the people that are using these modalities, that are seeking out um, professional health care through, whether it be a naturopathic doctor, a dietitian, through a holistic nutritionist like myself, through all of these trained professionals, that the tools that we recommend because we know the science is already there. So there are protection agencies within the natural health industry. So do encourage people to go to www.nhppa.org, and so it's sections 500 and 504 that they're looking to have removed from this bill, because those are going to be the most insidious and most dangerous for us as Canadians. We do deserve the right to, it's not Canadians that are taking proactive and preventive approaches that are putting the burden on our medical system that is so hugely overburdened. The doctors can't keep up, and the hospitals can't keep up. So why are we attacking the very sector of the population that actually wants that responsibility? And oftentimes it's integrative, right? That's what I do. It's like it's not this camp or that camp. Oftentimes and most times it's a combination of both allopathic and integrative that's going to be the best, but it's patient centered. And we as Canadians really deserve the right to be making those choices with our health, provided we are using a healthcare professional and that the products that are being recommended are products that have that natural product number. We've satisfied this already. So we really need to be reaching out and contacting and making sure that the government hears our voices, that we will not back down from this.
I think there's one critical word there that you used that I think I want to just um, work my way around. And you said attacking. And from the government perspective, they're probably thinking they're protecting. But I think an open dialogue with uh, natural health is the first thing they should have done. I don't know if that even occurred, right? And I think sometimes all of us, both government and everyday folks, get confused on those words. And I think it's
Mhm.
protection I get, attacking I don't. Like I think that's maybe where they need as
Yeah.
our MP should be looking into this. Obviously, Leslin, if you're listening, you should be looking into this because there's something else going on here that we don't quite understand
Mhm.
why they're doing this. But I will put that website down below on our podcast so folks can go and check that out. And I know we didn't talk a lot about health this month, folks, but it's important that when these things occur, that we understand what's going on around us. And I want
Mhm.
to thank Barb for bringing this to our attention because, again, didn't know about this was happening. I didn't understand it. And my family uses a lot of natural health products, and we're, as like you said, we're making our own choices, but we also look at what we're using and try and find out if this is going to work for us. And I
Yeah.
think that's the other part is educating yourself on
Yes.
being responsible of what's going to help you. You know what I
Yeah.
mean? And if it's not having the positive effect you're looking for, then obviously you're going to switch and look for something else. And I think
Mhm.
I don't like the government messing in my choices that way, to be honest
Right.
with you.
Right. And, especially when the products are made by very high caliber
Yeah.
industry professionals. And, I've always used natural health products for myself and for my family and, for my dogs, for my clients. But everything is researched, and it's always something that I'm checking with the allopathic, whether it be, the family physician or the veterinarian. It's you need to make sure all of that education is there because you can't just mix any supplement because it's natural with a prescription medication. The timing of both, all of those things over the years, I've written about that. We've talked about that on other podcasts, is that we need to keep a window so that there's no interference. So protection's wonderful. I'm all for
Yeah.
that. I
Me
was
too.
all for the making sure that the industry was up to par with the natural product numbers in the first place. I didn't think that was a bad thing for Canada to be forerunners. Um, but at the same time, this has gone so much deeper through a misunderstanding on a level of our government that has the ability to take that away from all of us. So, thank you everybody for, listening
Yeah.
and for looking into this and for standing up for your rights as Canadians.
My last point on this is a lot of natural products have been around for thousands of years.
Well,
Some work, some don't. We're not going to try and pull the wool over anybody's eyes, but at the same time, pharmaceutical companies haven't been around that long. So maybe we need to have the balance, like Barb's saying, and just look at both sides of the coin before you jump to conclusions. But definitely check this out, folks. Thanks for doing this. Great show today.
thanks so much, Dave.